Still good morning. So I appreciate the organizer for invitation today. This is the second time, especially the SOAR and CDC. So this is a great event to talk about the consequences of the drug. And Dr. Brenzel did a great job about the psychological aspect, and all the problem could be related. I'm going to start with his last slide. So the goal here, as we mentioned, is to increase awareness about the problem. So we need to screen more. We need to link this patient more to treatment. We have to recognize the addiction problem. If we cannot figure out that, so subsequently the whole system is going to fail, because this is going to be key in a lock. If you don't get the key in the lock, the system will not work. So we need to stop and combat that problem by figuring out the right elements for that problem. So my job here is to talk about the dynamic aspect of addiction and what are the consequences, and the message here that drugs definitely can cause some sort of infection. And this is related to two major problems. Number one, the behavioral issues related to drug addiction. And number two, the immunity that could be linked to it, because we know that these medication definitely is going to affect your immune system big time. And if your immune system is not working well, you will increase your chances of having infection. So there's a lot of repetition here, but the main issue here, we have a huge explosive increase in addiction. We have a huge crisis, and this keep going and going and going. And this is mainly related now to the move from prescription medication to addiction medication from off-the-street medication. I'm going to talk about them. And I think as a physician and health care provider, we have a big role in combat that. So we don't have to give pain medication to everybody. We have to recognize the pain problem, and we have to adjust it without using a lot of pain medication. We have a lot of physicians have a low threshold to prescribe pain medication, and this is not the right thing to do. So we're responsible for part of the problem as well. We cannot put the blame all the time on patients. So the problem also here in our area, we have low socioeconomic status, and this is affecting us big time. That's why part of the solution is not only the health exchange program, is not only finding the Narcan, not only like linking these patients to addiction problem, we have to teach them about the problem. So education is extremely high here. And I work on outreach program, and we have dynamic problems, and I think the addiction problem is part of the dynamic problem. We have to go to these people because they have low socioeconomic status. We probably need to go to do exchange program, like mobile program, probably go to them, or even finding what's called vending machine for exchange needles. So I don't know, we have to find solutions to make that key work on the lock and stop and combating that epidemic issues. So we've seen a lot of concerns about negative health effect related to drug. We know about all the communicable problems related to it, and this is mainly affecting the young population. This is basically what concerning us a lot. Younger generation affected. So what's going to happen later on? We're going to have increased comorbidities, we're going to have increased deaths, and this is what we're seeing at this point. So we have to have some sort of quantum leap to prevent the problem and avoid all these concerns. And this is basically very concerning, that slide. When the CDC did the study in 220 United States counties at risk and vulnerable for HIV, 54 counties in Kentucky. And this is related to the high and condensed IV drug user network. And this is very concerning. And the issue here now, we're having a huge problem tied with hepatitis A. And basically, believe me, we're lucky at this point. And majority of hepatitis A outbreak now in Kentucky are related to IV drug use and homelessness. And I was afraid that this problem will be at HIV level, like what happened in Indiana a few years ago. So if you put one drop of HIV in that messy mess, you're going to create a huge HIV outbreak. And at this point, we're very lucky we don't have that problem so far. I'm not going to go over these slides. And the reason to create morphine is just to help with the dreams. And this came from the god Morpheus. He didn't pay attention that dream is going to turn into nightmare, unfortunately. And that's what we're facing now. And again, here, Dr. Brenzel, he talked a lot about the physiology, but I'm going to talk about the immunity. So we're going to have a problem with the immune system. The active mechanism of immunity is going to be altered. There's no killing activity. There's no cold phagocytosis. And even our immune system is going to be weak and lazy. It doesn't go to the infection and affect it and kill it. Furthermore, these drugs will affect the immune system, starting from the brain with the maestro of the hypothalamus, with all the hormonal release linked to it, especially the cortisol. If you don't have good cortisol, you don't have good control on your blood system and blood pressure system, as well as an inflammatory system. So definitely it is linked to a lot of consequences, and especially at the immune system level. And it affects also autoimmune system as well as sympathetic system. So you're going to have problem with blood pressure and heart rate. So anytime you have like any kind of addiction, you're going to have what's called overlap syndrome. You're going to have multiple problems. And again, as I mentioned, and Dr. Benzel mentioned about the fentanyl was a key player here. This was the key driver, and that's why we see a lot of like addiction coming from polysubstance, not only one substance, basically multiple substance. And heroin is very cheap, very amenable. You can see it everywhere. You can go off the street and everybody can give it to you. Prince died from fentanyl. This is basically the problem, and you can make a fortune just from few dollars. So you can invest $600 in 1 kilo of fentanyl, you can make a fortune of $1.6 million. So unfortunately, this is a very sad story. So that's why we need our law enforcement to be a little bit tougher here. It's nice to be nice, but we need to be very firm when it comes to the health problem. So we need to combat that. There is a new medication on the street. It's pink, not from Victoria's Secret. This is really pink. So this is very potent, and this can kill people, unfortunately. And marijuana also can affect your immune system and can lead to more infection by weakening the immune system. And this is cocaine, can cause a lot of consequences, including the nasal bridge damage from the snorting, from the necrosis, in addition to weakened immune system. We've seen it mainly in HIV patients. HIV patients on cocaine, they have very rapidly progressive immunity damage. So they go further down the road compared to people without cocaine. So having said that, I'm going to talk about these infections quickly and about what are the problems linked and tied to drug abuse, from HIV, hepatitis, viral hepatitis, skin soft tissue infection, abscess, endocarditis. We're starting first with HIV. This is a major concern as well from drug abuse. So definitely could be related to drug issue, especially from sharing drugs and needles with somebody else. And people with drug addiction, they have rapidly progressive immunity damage compared to other people. They have psychological issue, depression, anxiety, and they don't take the medication very well. We know very well if you're HIV taking medication, you have same life expectancy like somebody else. However, if you do drug, you're not going to be compliant with medication. And subsequently, the chances of failure and progression is going to be much higher compared to the general population. So moving to a different entities, we're talking about viral hepatitis, and this is basically the newer outbreak of hepatitis A in Kentucky. And the last count, I think just 3 weeks ago, October 6, 2018, we have over 2,000 people with hepatitis A. Hospitalization, 55%, we have 14 deaths. This is definitely a major threat now in the state of Kentucky, particularly in the United States in general. And what's unprecedented about hepatitis A is the mode of transmission, from contaminated food to water to direct person-to-person contact. And the main two risk factors are going to be homelessness and drug abuse. So that's why I'm saying that we are lucky enough we don't have HIV outbreak so far. Hopefully it doesn't happen. So restaurants a major issue now, and we got a lot of concern from restaurants. For me, like the best way to treat that is going to be vaccination. Vaccination is a key factor here to prevent the hepatitis A outbreak and give you some immunity. And for me, when they talk to me about the problem from the city, I believe all people working in restaurants, they should have vaccination. And this should be sort of employment. So this is a requirement for employment. This is my personal opinion. Moving back to hepatitis C, it's a major issue, and this is directly linked to drug issue. We have almost 5 million people in the United States. The problem with that, 50% unrecognized. 1 of 2 people with hepatitis C, they don't know they have hepatitis C. So, and a lot of people, when we talk to them about drug issue, they say, I've never done it, probably 20 years ago. The problem with hepatitis C, you can deny it, but your liver are going to memorize it very well. Once you test them, it's going to be positive. So the good thing about it here is the cure rate. We're talking about cure rate 95% and above. So that's why we need to screen these patients and we need to link them to care. This is the best option at this point. This will prevent huge complications down the road, especially hepatocellular carcinoma and liver failure. And we know that liver transplantation by itself will cost $600,000. So if you prevent them from progressing down the road and having complications, this is going to save money to our health care system and allocate the money for the right patients. So these are slides talking to you about we're leading the country, by the way, in acute hepatitis C. Unfortunately, we have the most per capita compared to the rest of the country, and this is nothing we have to be proud of. So the other problem is going to be hepatitis B as well. It's coming from drug issue, and this can cause liver damage. 1 out of 3 they don't know about hepatitis B. So that's why these exchange programs are very helpful to screen these patients. I feel these are frontline like centers to screen, to treat, and make sure they're using the cleanest needle. So I don't perpetuate usually for the exchange program, but this is going to be a very helpful buffer zone until we find solution for our problem. So we talk about these briefly. I don't have to repeat them. And the other major problem now we see very frequently, and this is a very sad story, the endocarditis, which is infection of the valve. Anytime you shoot drug in the vein, you're going to push some bacteria, you're going to push some dirty product, especially the talc and the cotton as well. And these complex situation going to go to the heart, going to sit on the heart, cause inflammation, and your body is going to do something for it. They're going to prevent it from causing trouble. So it's going to fight, creating what's called vegetation endocarditis, and unfortunately the valve would get damaged, and these people, they can go into acute heart failure and they can die. On the top of that, these patients can have multiple sites of infection. We call it dissemination, called hematogenous dissemination. And this is an example of a patient who came to me for severe chest pain and pleurisy, and we did an x-ray for him. He got multiple cavitation on the lung. As you see, he was using Opana. And then after you see that picture, the first thing comes to your mind is going to be endocarditis. You admit the patient, do blood workup, and this is MRSA infection. And this is coming from severe 5 centimeter vegetation on the tricuspid valve, causing him like severe problems. So this patient required tricuspid valve replacement, and this is something not cheap. This is very expensive, unfortunately, and especially once you have valve replacement, you increase your chances of having more infection down the road. So that's why preventing the problem is very helpful. Will prevent causing infective endocarditis and subsequently a lot of complication down the road. And these, what we call them dissemination, multiple sites in the skin, in the eye, in the nails. So these are also called them stigmata of dissemination of endocarditis, and this is showing you the valve like completely messed up and destroyed, and this is because of the endocarditis, and this is called huge vegetation on the tricuspid, on the aortic valve. This is almost 3 centimeter, leading to valve perforation in somebody who's 32 years old. So we've seen people now coming with stroke, so they have weakness in the extremities, upper, lower, 19, 20, 30 years old, very sad story. And anytime you have a stroke in young patient, think about endocarditis. So endocarditis can definitely lead to a lot of morbidity and mortality in these patients. They become so desperate because they cannot use their limb, they're young, they're not functional. So definitely it causes not only organic dysfunction, but also mental dysfunction. So here somebody also with endocarditis came with a huge bump on the chest. This is infection of the joint. And this is very common endocarditis. You open them up and you have a squirt of pus coming from it. So they can go also to multiple areas of the joint, at the bone. We call what's called ileitis and also some joint infection. And this is basically here the most common clinical manifestation you see with drug. Anytime you put a needle in the skin, it's going to be dirty. And majority of them, they're not going to do it well. They're not well educated, low socioeconomic status. They don't clean. They use tap water for that, unfortunately. So at the site, you're going to have infection. So this is basically the first one, so abscess. The second picture showed like widespread dissemination of the infection with more erythema and redness with induration. And unfortunately, the one in the bottom is called necrotizing soft tissue infection. And this is related to one of the newest medication called crocodile. And this is coming from the Russian magic necrotizing fasciitis. So you can go to nirvana immediately after that. So this is very helpful for them. Unfortunately, to make the crocodile, which is a derivative of morphine, you have to mix it with other product, thinner, pain thinner, gasoline. So anytime you push gasoline in the arm, what's going to happen? Severe burn and necrosis. And these people sometimes can lose limb because of that kind of behavior issue. And this guy, he's 18 years old, who lost his limb because of drug issue, unfortunately. So again, this is basically how I figure out, see you later, alligator, unfortunately. So how do you impact the problem? So awareness, very important. So we need not only to talk to you, I think the problem, we need to reach out to the addiction problem. So to the IV drug users. I don't see any advertisement on the media about drug abuse. We see about smoking. I've never seen anyone about drug abuse. I think we need to put more advertisement about IV drug use and the consequences of the drug abuse. And especially in the poor areas, we know that the main source of contact with the outside world is television and radio. So I think we have to activate these two systems. Majority of people here, they don't use internet, unfortunately, because of the low socioeconomic status. Subsequently, we need to activate the radio and television. So we have to put more advertisement, and we need to address that problem directly to the drug users. Number two, we need to talk the same language. Physicians, they have to know about the problem, screen more, link them to care, and they don't have to be afraid of treating that problem. This is part of your duty to treat the problem. Number three, Narcan, this is definitely an option. Exchange program is an option. But in my opinion, we needed to make it more dynamic. We need to, let me go to the other slide. It's going to take forever for this one. Anyway, so we need to go to these people, this is in my opinion, because this is the best way to tackle our goal and let them understand about the process. I don't know what's going on, just one more. All right, so we need to go basically to them, teach them about it, and these are going to be, as I mentioned, great buffer zones for us. We don't have good success here in Pikeville, and this is basically related to the socioeconomic status. These people, they say they don't have money, we don't have the transportation, and they're not aware about the complications. So probably if we move these programs, make them mobile and go to them, like every week, every month, we go some area and let them get educated about the process, probably will be a little bit more successful. And as I mentioned earlier, these buffer zones are going to be very great help to screen for hepatitis C, hepatitis B. We can treat them, we can cure hepatitis C, we can treat hepatitis B as well as HIV. We can talk about the addiction issue, we try to hook them to addiction programs. So, and could be a major source of health. So we can screen for high blood pressure and the other issues. So this could be definitely a helpful situation for these people with poor socioeconomic status. So one of the suggestions, get needle exchange machine. So I don't know, can make it may work down the road, and instead of the cake you can give needles instead, and make sure there is a box that you can exchange the old needles. Again, I'm not perpetuating for that, for drug abuse, but should be a good temporary solution until we find the real solution for these issues. Number two, mobile clinic. We don't have it here. These people, they don't have access to health care, and probably if we put more of these mobile clinic, this can maximize our goal. So I think these should be good options down the road. So we need the help. These people, they need the help, they need the support, they need the guidance and assistance, and hopefully with more like awareness programs, healthcare fair programs, we need the government definitely support for that. In addition, we need to show leadership, and we need to show that we care about our community and work for that community. I think by educating these IV drug users, hopefully we'll be able to make a change, because word can be also as effective as medication. So hopefully this will work. God bless.